Welcome to the next episode of the LIT Show. The LIT Show is a program organized by Dr. Raut's Center for Reproductive Immunology. Dr. Raut's Center for Reproductive Immunology specializes in the treatment of unexplained repeated pregnancy losses, unexplained IVF failures, and unexplained infertility with the help of reproductive immunology, especially lymphocyte immunization therapy and other passive immunomodulatory treatments. In this show, we interview various gynecologists, infertility specialists, IVF specialists, and even patients who have been benefited with the treatment of lymphocyte immunization therapy. Today, let me introduce to you a very young and dynamic doctor, Dr. Amiti Agarwal. Welcome, Dr. Amiti Agarwal.
Thank you so much, ma'am. Thank you so much, sir, for having me on the show.
Let me give you a brief introduction of Dr. Amiti Agarwal. Dr. Amiti Agarwal is the medical director of Sunshine Fertility and IVF Center in Mumbai, with 8 years of experience in infertility and gynec endoscopy. She pursued her advanced training in IVF from various centers in India and abroad. She did her post-graduation in obstetrics and gynecology from one of the oldest and premier teaching institutes in South India, 𝐂𝐨𝐻𝐿 Medical College, Davangere, Karnataka. Having 3 teaching hospitals attached to the college with about 400 beds, with a massive input of patients and about 1,400 deliveries, it's a hub for learning and managing high-risk pregnancies. She completed her MS degree successfully after building excellent rapport with her teachers and colleagues, I think which she still maintains. Following that, she completed a fellowship in minimal invasive surgery under the stalwart Dr. 𝐂𝐨𝐮𝐫 at Mumbai. She's also completed her fellowship in reproductive medicine from a reputed infertility hospital at Kerala under the guidance of Dr. Mohammed Ashraf. Following that, she pursued her master's in reproductive medicine from Homerton University, London. In fact, she was offered a job in UK immediately after her fellowship because of the quality of her work. However, she chose to come back to India and serve her fellow citizens. After coming back to Mumbai, she joined Bloom IVF Center as a consultant and center head. After 4 years with Bloom IVF, with a vision to provide world-class IVF treatment at affordable cost, she started her own state-of-the-art Sunshine Fertility and IVF Center. She has an undying affinity towards the enigmatic and upcoming field of IVF and endoscopic surgery. The whole idea to actually create life in vitro and bringing a ray of life in the lives of infertile couples fascinates her to the core. She has, of course, excellent communication and oration skills, which we will hear during the show, and can win over many by an impressive and a smiling disposition. At such a young age also, she has been conferred the Midday Youth Icon Award by Shri Devendra Fadnavis. Recently, she won the Excellence in IVF and Reproductive Medicine by the Governor of Maharashtra, Shri Bhagat Singh Koshyari, and Health Minister, Shri Rajesh Tope, at the Raj Bhavan in 2021. So, I think Dr. Amiti Agarwal, let's go ahead with the show.
Thank you so much, ma'am. Yes, sir, please.
That's great. I think with such big biodata behind you, we are really privileged to have you here on this LIT show. And I think, before we start the detailed discussion, the first question that comes to our mind is, why do you choose the field of infertility?
First of all, thank you, Madam and Sir, for the very, very elaborate and amazing introduction which you gave. I'm very humbled and very honored that at this age I've been invited to such a big show. I mean, it may be a startup show, but I think the concept and the whole thought process behind having this show is really brilliant. And I'm really sure that this show is going to really attain some really big heights, and it's going to become a very, very popular show amongst the patients, amongst doctors, and amongst our other fellow colleagues. So I'm very happy to be here on this lovely Sunday morning. So to begin with, why I chose the field of infertility, there is a little interesting story behind that. So what happened was that my parents obviously got married when they were very young, and I was immediately conceived. And that time, my father, he's an orthopedic surgeon, so I was conceived immediately 1 year after their marriage, and then I was born. After that, my dad, he was doing his post graduation, and they were during their struggling phase, so they didn't really think about the second child at that time, and they had me and everything was going fine. He was studying in Kanpur. They are actually based in, my father is from Gorakhpur, but he came to do his specialized training in Bombay at Bombay Hospital with Dr. 𝐾𝐸𝐻𝐸, who's a pioneer of orthopedic surgery. And it's a very filmy kind of a scene where my father was driving from a motorcycle through that whole Queen's Necklace just before reaching Bombay Hospital. And when he saw the sea and when he saw the beautiful Bombay coastline, he just fell in love with Bombay. And he just, when he entered the gates of Bombay Hospital, when he saw the style of working and the kind of advanced things which are happening in Bombay, he called his parents and he said that I am not planning to come back. This is where I want to be. This is my dream, and I have fallen in love with the city, and I want to build my life here. So my grandfather said that, you have everything here. My grandfather too, like we are almost four generations of doctors now. My grandfather was one of the first most successful gold medalist psychiatrists from Uttar Pradesh. He was the person who had got a gold medal, and his name is even till now a really, really big name in Gorakhpur. So he said that, my son, you have an entire, established practice here. I'll build you a hospital. I'll do everything, whatever is required. And your struggle will be much less if you stay here in Gorakhpur. But he decided that he wants to be in Bombay. So he was busy building his. So my grandfather said that, okay, you can be in Bombay, but you'll have to build everything yourself. There's nothing I can do. Neither do I have contacts over there, nor do I have any kind of property to give you to build a hospital or anything of that sort. So my father said that I have the confidence. I'll do it. I just need your support and your blessings, and I will make it happen. Slowly, slowly, he was there in Bombay Hospital. Then he started, working for other nursing homes. There was a time when he was attached to almost 8 nursing homes all over Bombay, and he used to keep running the entire day, trying to, make things work. Finally, he built slowly, slowly started building. He built his first hospital, then second hospital, and touchwood, by the grace of God, he's doing very well. So in the process of building his life in Bombay, there was a lag between, his first child and the second child. So when they actually started planning their second child, they started facing some infertility issues, and really major infertility issues. Like my mother developed some kind of Asherman syndrome, and even, lot of things were there. I'm not getting into the story because it's going to take too much of time. So whatever happened, they consulted Dr. Sadhna Desai. They had some 7 or 8 failed IUIs, and this I'm talking about 23 years back. Now IVF is like become a very common thing. Like every corner of corner of the city, you may find a board of an IVF center. Every gynac today is an infertility consultant. So now that was not how it was 23 years back. There were just 4 or 5 selected popular names of Bombay, and everybody used to go to them. So Dr. Sadhna Desai, madam, she is like one of the biggest pioneers. So they went there, and they did so many IUIs. They did IVFs, and you will not believe, she conceived at the third attempt. She conceived with triplets, and unfortunately, she aborted at 6.5 months, almost 7 months touching. And she actually saw 3 dead babies right in front of her eyes. And that was such an agonizing experience for her that 1 year she was in very severe mental depression. She was in trauma. And finally, after 1 year, she got out of it. And that's when Dr. Sadhna Desai called my mother and said that, see, I know it's been a very difficult journey, but I still have 2 of your embryos frozen with me. And I really feel that let's just give it one shot. If you're ready for it, let's just give it one last shot. And if it happens, it happens. Otherwise, you already have a daughter, just leave it. And to be very honest, It was not my parents who were dying for a second child. It was me, because every time when Raksha Bandhan used to come, I used to, we were in Bombay. My entire cousins, all of them are in North India. I don't have any cousins here in Bombay, so I used to always cry on Raksha Bandhan, on Bhai Dooj, that I want somebody to tie a rakhi to. I want a brother. I want a brother. And I used to really really cry. So my parents said, no, for her we need to bring a sibling, even if it's anybody, like a boy, a girl, anything, but we want a sibling. So then my mother finally got the courage, and Dr. Sadhana had become like her mother figure. It often happens to you, your patient who's been coming for you for so long start looking up to you, as an elder sister or as a mother figure. So she said, you come and you do it. And then final attempt, she did the embryo transfer and everything went fine. And finally my brother was born. So when my mother was holding this baby in her hand, I still distinctly remember this scene. I was 11 years old that time, just 11 years old, and we were at Bombay Hospital, and she was holding this baby in her hand, my brother, and she looked at him and said that मैं अपनी बेटी को IVF consultant बनाऊंगी. You know, she,
Oh,
she told my
great.
father, she told me that, you have to be an IVF doctor. That time as a child, I didn't even know that what is IVF, what is an IVF consultant, what is what, I didn't even know what is gynecology, at 11 years. But this is what she said. And my parents have done everything possible, even it beat my education. They have not left any stone unturned. Any courses, whichever I tell him I want to do this for, my dad used to get into it. He used to find out, and they have given me the best kind of education a girl in India can ask for. They have left no stone unturned. And when even today, if I'm called for even a single seminar or presentation, I tell my mother that I'm going there as an IVF consultant. There is so much of pride in her eyes. She says, you have made me proud. A dream which I saw 23 years back, you have made it true today. So that's why I am an IVF consultant, and I couldn't be anything else. Even if God tells me that I give you opportunity to choose another branch, or I give you an opportunity to choose another, you don't want to become a doctor. So many youngsters now say कि अरे doctor की तो कोई इज्जत नहीं है India में, it's your waste. But I beg to disagree. I don't think there can be a more noble profession. I don't think there can be a more satisfying job than an infertility consultant. And that is the reason why, majorly, my mother, that I am here as an infertility
That's
consultant.
a beautiful and really a touching story.
Yeah.
And now I think we can understand
Yeah.
where your passion comes from,
Yeah.
and to pursue a dream at that from that time. I think that is taking you leaps and bounds ahead.
Yeah, I mean, even today, like my brother is now, he's in final MBBS. He's 23 years younger to me. He's 11 years younger to me, and he's 23. And even today, I tease him, you know what, you are a frozen embryo, tu to frozen embryo, and he laughs at me, but it's such a pleasure to see him, because I have seen the kind of struggle which my parents have had in having him. He's such a precious baby. And so I can resonate with how infertile couples feel when you get an IVF failure, what they go through, when you see a UPT stick which shows only one line, what happens in the mind and the psychology of a patient. This is something which I think every doctor should really understand, should resonate. And once you start resonating with that feeling, I think you can do wonders at your work, because that's when you understand that, okay, what can I do? How can I help this person? It's something which I think all gynacs should inculcate. I'm not saying you should get very personal with the patient, but when you try to actually understand the pain that that couple is going through, only then can you give your best shot.
I think that is the reason why your special interest is in treating couples with multiple IVF failures,
Yes.
polycystic ovaries, and
Yeah.
also that's why probably your gynac endoscopy work is also
Yeah.
something which interests you a lot.
Yeah, very
I
much.
think, and Dr. Amiti, you are a perfectionist. That's what
Yeah.
we realize that. So for this, you wanted to be a perfect doctor,
Yeah.
and as you said, ki your parents never left anything that you wanted to do. They allowed you to do everything. So can
Yeah.
you share some of your experiences of different trainings that you gave? Even abroad, you
Yeah.
had gone.
Sure.
So can you
Uh,
share some experiences?
Sure. So I've had the pleasure of having the best of the best teachers. I've got the pleasure to work in the best of the best institutes at the right time. So when I got my admission in JJM Medical College Davangere, when I went over there, being a Bombayite, and how some children of Bombay are like, they have got that whole classy thing. And when I went into Davangere and I went into the hospital, I was so stunned to see that there were patients lying on the floor. There was so much work. There was so much work. I mean, I would see that, I went into the labor room. There were like 8 beds. All 8 beds were jam packed. There was so much of cut work. There was so much of obstetric exposure. We had all sorts of complications which you can find in the obstetric books, standing right there in front of you. So in that 3 years, I got absolutely grilled. I was absolutely grilled, practically. I was exposed to all possible kind of complicated cases, right from bladder injuries to very very bad postpartum hemorrhages, to intrapartum peripartum hysterectomies, to uterine artery ligation. So that 3 years was like exclusive obstetric work, which was really hardcore obstetric work. And not only that, even the academics, the kind of professors we had, we used to have very very rigorous kind of weekly classes, and we were supposed to present cases, and those used to be so grilling that we used to actually have nightmares. Like the date used to be given to us almost a month before, but that 1 month we used to just sit in the library and just go on reading and reading. And how much ever you read, somehow there was some point which was always missing. That was the kind of rigorous training we got in JJM Medical College. I mean, I owe everything to it, because when I came out of that college, there was so much, I was beaming in confidence. There was so much confidence that just bring out any case and I would do it. Even today, that I've been seeing so many people like my colleagues or even my contemporaries who would not put a hand into a very complicated obstetric case, like very severe preeclampsia or a very severe IUGR patient or anything, unless it's in an institute. That no, this case cannot be done in a nursing home setup. It needs to be sent to an institute. You can't do it. But this is something which, touch wood, till date, I am now, I mean, my own private practice, almost 6 years down, I have never referred a patient to a higher center. Touch wood. I think 1 or 2 centers which I have sent where the patient is absolutely not affordable for any NICU backup. So my obstetric training was brilliant. After that, when I came to Bombay, I realized that there's a lot of endoscopy work which I need to learn, because in my PG, it's in PG colleges you don't have much of laparoscopy exposure, because everything they are mainly focusing on open surgery. They are trying to teach you the anatomy of the pelvis. They are trying to teach you, and in government setups, in Davangere, it was a tertiary center, so there was not much exposure to laparoscopy. And when I came to Bombay, I realized that in Bombay you cannot you cannot survive by not knowing minimal invasive surgery. So even back in college, I used to read a lot of books, and in the pictures I used to write surgery by Dr. Rakesh Sinha, Dr. Rakesh Sinha, Dr. Rakesh Sinha. So that thing was there in my mind that if I come to Bombay, I'm staying. Fortunately, he's in Bombay, so I want to learn laparoscopy from him, because I keep reading that name. So I know that okay, this guy is really really good. So when I came back, I did a lot of research on sir, and I figured out that he's one of the best that I can learn from. That time it was sir's protocol that he usually used to not take patients who take fellows who are from Bombay. Usually he used to take outstation fellows. I don't know, whatever the reason was. So I went to him and I told him the story that, sir, I've been seeing your name in all books. I've been seeing you, I've heard so much about you. I want to learn only from you. And whatever it takes, if you tell me to stay 6 months in your hospital, I will serve in your hospital as a fellow resident, whatever. But I want you to teach me. That's what I told him in the interview. I said, whatever it takes, I want to be your student. So he was like, no, my batch is already full. And, I came back after completion of my, finally he said, let me think about it. And after 1 week, I got a call from the hospital that he has selected you as a fellow. So that time I had the pleasure of being exposed to some really advanced laparoscopic surgery. It was so brilliant, like the kind of surgery. He was the first person actually who had got the 3D Einstein vision, and he was doing 3D laparoscopic surgery. It was such a treat. It was like a brilliant movie that you're watching on screen. The way he used to, just pop off fibroid like, like a scoop of ice cream from a bucket of ice cream. He was so brilliant at his job. I think I've now seen so many laparoscopic surgeons, but nothing can match what Sinha sir is. So I got the privilege of working with him, and that's when now that my laparoscopy hand was good, I finally, even sir told me that, why don't you join me as a junior consultant, and then eventually you can be a part of the whole women's hospital family. Then my father said that no, this doesn't end here. You have learned laparoscopy, you need to know infertility. That's when I had told my dad that, see, I'm loving laparoscopy and I don't want to get into infertility. He said, ki, you, this is your time where you develop all your skills and then you choose whichever you are best in, you go into that field. So my dad pushed me. He said, find out which is the best place for learning IVF, and then you do a fellowship there. After that, you choose. You're good in obstetrics, you're good in laparoscopy, and you're good in IVF. You choose what you want to do. That's how I started searching colleges in India again. And then I came across, see, there are a lot of centers even in Bombay, there are a lot of centers Gujarat who are conducting a lot of fellowship programs. But learning IVF is not something which can happen in 1 month or 15 days. You need a dedicated 1 year of very dedicated fellowship to actually understand the minute things of IVF. Like it is so extensive. Like people just feel, "Arey, 10 days injections hai, pick up head, ETA, what's the big deal?" It's not that. There is so much more to it. So I found out this college hospital which is in Kerala. My senior, in fact, guided me through it. As I told you, I had a brilliant rapport with my seniors and my colleagues, my teachers. So there was always a lot of help which I got from everywhere. I got a lot of help from my parents. I got a lot of help from my colleagues, and everybody was there to help me. So my friend said that, see, I am pursuing that fellowship, so you also apply. I went there again. I saw they were brilliant work. They were doing such brilliant work. At even like now, 5 years, 6 years back, I did my fellowship. Sir already had the NGS2 platform. He already had a genetic wing in his lab. He already had the embryoscope, the anything under the sun was available there. And there was the minute you enter Kraft Hospital, there's this whole hall which is full of patients, infertility patients. So you go, and I went and found out like how many cycles. So almost they are doing 120 to 150 cycles alone in a month. That was the kind of workload which was there at Kraft. So this is not even like this hospital is not even in Cochin proper. It is around 20 kilometers more interior of Cochin, which is almost like a village that I stayed in. But the kind of exposure which I got there again was something which I don't think I could have ever got in Bombay or any other place for that matter. We were given hands-on in pickup. Almost in 1 year of my tenure, I did almost 50 to 60 individual pickups. We were given hands-on training in laparoscopy. We were given hands-on training in andrology. You will not believe I am trained to do all andrology work also. I can do TISA, I can do micro TISA, even though I call a urologist to do that. But if you give it to me, I can do that. So there was like a very beautifully programmed course where they gave 3 months into IVF lab. They gave 3 months into, the stimulation part. They gave 3 months into ultrasound. They gave 3 months into andrology. So it was a very well programmed thing. So when I finished that, then I came to Bombay, and I started applying into different hospitals because my dad said that, okay, now you are, I keep saying my dad, because they have really, hand-holded me so much. Despite being an orthopedic surgeon, he has such an insight about how things work. Then I came back, and when I came from Kraft again, I was very confident. Okay, now I'm going to just start my center. I'm going to start my dad said, no, you have come from Kerala. Now you need to understand how things work in Bombay. You need to be exposed to an IVF center. You need to understand how an IVF center works in Bombay. You need to understand where do you get your equipment from, where do you get your media from, how do you deal with the patient, how do you talk to the patient, how do you counsel the patient. So he said, you find out a good place which can give you that kind of not training, where you can sit like a consultant, take independent decision, but there is some boss who can handhold you and help you out. That's when Bloom IVF came into the picture. I went to Rishikesh Pai sir, and of course, the first meeting he was very busy, he couldn't see me. But then I got a call that sir wants to see you. He saw your resume and he's very impressed, so he wants to see you. And I went and saw him, and sir, I don't know what he saw. Right in the first shot, he said, "Ki 3 months you're going to work in my Bandra center, and then I'm going to make you the center head in Opera House." And immediately I was made the center head in Opera House, and my Bloom experience has been so enriching. I owe so much to Rishikesh Pai sir and Nandita Palshetkar ma'am. They were the ones who came and inaugurated my center as well. And they've always blessed me. Dr. Rishikesh Pai sir is like a father figure for me. And even madam, always hand holding, always helping. They gave me the independence to take independent decisions. They would ask me, "Terko kya lagta hai, kya karna hai?" I would say, "Sir, we'll do this." And they would just say, "Yes, okay, go ahead and do it." They wouldn't be like, "No, what you're saying is wrong, what you're doing is wrong." So the whole IVF exposure in Bloom IVF was very path breaking for me. And I got opportunities at various platforms in like AICOG and ISAR, where sir pushed me into delivering talks. So even the whole exposure to the IVF world was, sir has played a very very instrumental part in making my career. So when 4 years were down, I started my practice even private. He gave me the permission to do private practice as well as work for his center, which worked very well for me. So I had my own pool of patients in Bhandup, and I had that his patients which I was taking care of. So eventually, after 4 years, finally I decided that now it's time to fly on my own, and I started my own IVF center, which is Sunshine Fertility in Vikhroli. And by God's grace, as I've discussed, by next year we'll be starting our second branch in Santa Cruz.
Oh, that's great. Congratulations.
Thank you, sir.
Yeah.
So
I think now that you were trained thoroughly in different aspects or different fields,
yeah,
and you started your IVF practice, but still in your practice you must be facing certain patients, challenging cases.
yeah,
And what sort of challenges you face in your practice? Certain
okay.
type of patients or
Right. So, sir, the I would say the very plain and simple cases would be very simple ones, like maybe PCOD in which the eggs wouldn't grow, then blocked ovarian, fallopian tubes, then some minor sperm factors like severe oligoastenospermia, wherein the sperm is around 5-6 million. So these are, I put them in the category of very simple kind of cases where we have got young couples who, because of some kind of anatomical problem, are not able to conceive. So those are very simple cases to deal with. Not just me, I think any good IVF center delivering good results can give those patients results. The real challenging patients who come are the ones who are having repeated IVF failures, who have come with absolutely zero or maybe minus confidence that they can become parents again. That is the previous multiple IVF failures. Second most challenging come who are having repeated miscarriage. No matter what the patient does, no matter how much low molecular repair, no matter how much ecospin, no matter what they do, the patient just wouldn't go beyond 8 or 9 weeks. So this is one very difficult patient category which I come across. The third very important category is very very bad endometrium, a very poor endometrium where you do anything and everything possible, but somehow the lining doesn't grow. Even we've got brilliant little floret looking embryos, beautiful book like embryos, but you can't put them in because the lining just wouldn't grow. So I think these three, and of course azoospermic patients who are having really deranged hormonal parameters, where maybe they've had failed micro TISAs also in the past. So I think these four category of patients are the ones who are the most challenging ones. And to be very honest, lately I have been getting a lot of such patients. I don't know why, but a lot of IVF failure patients I'm getting from all over the country. I get patients who have had 7-8 IVF from real big people, real stalwarts of India, and they come from different parts of the country. They come from Udaipur, they come from Lucknow, they come from a lot of places. Maybe some old patient who's referred or whatever. So I've lately been getting a lot of these patients, and I feel this subset of patients are the most challenging ones to deal with.
How do you treat these patients of unexplained infertility or repeated pregnancy losses or IVF repeated implantation failures, which we can
Right.
call?
Okay, so in our clinic, ma'am, we have got a concept in which every month we have a negative result meeting. Okay, so in which what we do is, this happens every month. This is not something which we do once in a while. We do it every month, wherein we sit across on table, me, my embryologist, my other counselor, and sit with the patient's file, and we check each and every parameter about why the patient has had a previous failure. Of course, even we have IVF failures. We don't have 100% results. So I do have patients who had one failed IVF with me or two IVF failed with me. So we actually sit and we try to analyze each and every step about this case. So we start right from the age of the patient. We start from what kind of injections were given. That time we explore even the batches of the injection which has been given. We try to speak to the distributor and ask them that this particular batch, is there any problem with other clinics or only we are facing a problem. We talk about the number of embryos we've obtained, number of eggs we've obtained, how the pickup was, whether the expected follicles were the same as the ones we were seeing on the ultrasound, how were the hormones, whether the E2 levels, the LH levels were corresponding with the oocyte, output. We would go into how the ICSI was, whether the ICSI was a difficult one, whether the embryos, whether the oocyte was too easy to enter, whether it was a difficult ICSI. We get into that and we analyze the embryos. Also, we see the endometrium. We have a protocol that when we do the embryo transfer, we take a sonography image as well, because you do so many transfers, many times you don't remember how the endometrium was. So we have a protocol where we take an image of that embryo transfer and we paste it onto our embryo book. So we know exactly where the embryo was placed, whether there was some blood in the inner catheter, whether there was some kind of fluid, whether the endometrium was thin, anything, anything and everything is noted down for that patient. So that when we sit for the negative counseling, we understand what exactly could have gone wrong. So many times we see that everything has been really perfect. The patient doesn't have was given beautiful embryos. The patient's endometrium was good. She was not too old. I again emphasize that age, I think, is the most important factor in deciding the success story of a patient. No matter how you can beat around the bush as much as you want, that no, age doesn't matter, or we can do PGT, we can do this, we can do that, whatever. I think age of the woman rather is one of the most important factors which is going to decide the fate of that patient, whether she's going to deliver a healthy baby or not. This is one parameter which really makes a big difference. So we analyze all of that. So many times we have seen that despite everything being fine, good quality embryos, good number, good endometrium, good hormones, age is fine, everything fine, the patient doesn't conceive. So these are the kind of patients which make it all the more challenging. कि अब what to do next? Like अब क्या करें? Like what to do? We have done everything which is possible. So that's when now in today's times, where immunology and genetics has come into the picture. Many years ago, we wouldn't even look into those aspects, but now with the changing times, I think these are the two most important things which have come out, that is the immunological factors and the genetic factors of a woman, and of course the implantation. So that's where we have got three upcoming thing, not no, I wouldn't say upcoming because it's already out there. So we have got ERA, which is the endometrial receptivity array, we have got the genetics, and we have got the immunology. So these are the major three things which act as the blind ghosts in a case. And if you're able to tackle these three, I feel that out of these three, almost always one is the cause of the infertility. And if you're able to pick that up, you will be able to give the patient a pregnancy. See, it is not possible that everything is ruled out. Even you as doctors must be having so many. I think you've done more than 12,000, I think, cases so far dealing with reproductive failures and miscarriages. I'm sure that almost 90% patients who are sent to you will show some kind of positivity towards immunology factors, whether it is the HLA problem, or whether it is a TNF alpha problem, or whether it is the uh, anti-thyroid and globulin problem, antibodies. So somehow we are getting the answers over there, and if we are able to figure out, we are able to explore those options, I think we are done, we are through. And I will discuss about a lot of success stories which you and us have managed to do, which have been some really difficult cases where people have given up, doctors have given up, and they have told patient that no, nothing doing, you have to go for surrogacy now, or nothing doing now, you have to go for a donor egg. But these patients who we have tackled, we have managed to give them their own embryos in their own uteruses, and they have even delivered children. So that's why I share a very special connect with both of y'all, ma'am, because I think y'all are like my to-go place. Nothing is working on. What do I tell the patient? Because even counseling the patient becomes becomes a big hassle. Where the patient would say, Ki, I'm doing 2-3 cycles with you, but I'm just not getting. What is the problem? Should I change my doctor, or what should I do? So that's when you have to have an answer. You have to tell them that what else could it be, and when you explain them and counsel them about this whole immunology part, they too understand. And when it is reflected in their reports, wherein the antibody is high or the TNF is high, whatever, they develop the faith and they go ahead with the therapy.
Can you share any of these, some of these cases,
Yeah.
if you remember
Sure,
distinctly?
sure. I will not give the names, of course, because we are on a we are on a social media platform, and it's not right to give the names. So I think ma'am would remember very well. So we had this patient who had I think 4 or 5 miscarriages. She had one IUFD, intrauterine fetal death, at 4 months. She had missed almost 3 or 4 missed abortions, and she, out of those 4 or 5 cases, I think 1 or 2 was IVF conceptions and the other were all normal conceptions. In fact, the IVF conceptions which she had, which also ended up in miscarriage, that doctor had even done PGT. They had even done the genetic testing of the embryos, and only the genetically normal embryos were put inside. But despite that, she ended up in a miscarriage. So this patient, it was like literally her case sheet was shouting loudly that, I need to be sent to Dr. Raut. So this patient, when she was sitting right in front of me, I figured out, because when she came to me, she was on the 12th day of her period. I did a sonography, and it was this beautiful fluffy endometrium, the perfect ideal endometrium that we look at, the beautiful fluffy triple lamp endometrium with a very good vascularity. And she's not too old. This patient is like, I think 34 or 35. 35 is not old. So she's like 34, 35. So I figured out that, this patient definitely is going to require there is some immunological factor which is involved. So I told this patient that, see, we will first get you consulting with Dr. Mugda or Dr. Mohan sir. Let them evaluate your case, and then we'll see what happens. So I think she had come to you, and you had done all the tests, and a lot of reports came positive, and it was showing that she's having some kind of, immune. She's kind of not really accepting the embryo, and you did the LIT therapy. And in the very first shot, I did blastocyst transfer. I said I'm not going to do anything short of blastocyst. Fortunately, I had six or seven embryos for this patient. I did the transfer. The very first shot, she conceived. I had put two blastocysts. She conceived with both of them, but one of them reduced and got resolved at 6 weeks, and the second one grew up beautifully. This patient did very, very well with LIT. LIT was done after 6 weeks. I had done the embryo transfer, 1 month break and 15 days to prepare the endometrium. And she did so well. Unfortunately, at 31 weeks, she ended up in some obstetric complications, because of which I had to terminate the pregnancy early. The baby was just maybe 1.5 or 1.6 kg, was in the NICU for maybe around 3 weeks. But today the baby is around 8 or 9 months, nice, healthy 5 kg baby boy. And the parents and everybody is so grateful. Means it was something where people told him that, you can't be a mother. There were doctors who told her that you have to opt for surrogacy. You get your sister, we'll do it for her. If money is not a problem, you'll have to go for a donor egg. You cannot mother a child, all sorts of things. And so she came with me. She was so distraught, and she was totally shattered. She was like, I want to be a mother. Fortunately, I'm blessed with everything in life, but this is something which I want. And I come from this conservative family, which they wouldn't understand the meaning of a surrogate. Even very educated families today don't accept surrogacy that easily. You need to have a very different level of maturity and understanding, not just for the couple, but for the entire family to accept something like surrogacy. So this patient is so grateful. Every time if any milestone thing happens for her child, she'll send me a picture. She's so grateful. So this was one very good success story. And after that, this particular patient sent me another 4 or 5 such difficult cases, which I am now in the process of evaluating and just sending them one by one to you.
No, absolutely right. I think it is really nice of you to consider this angle,
Yeah,
immunological angle in this patient, because
yeah,
we have seen quite a few patients. I think one of Dr. Mugda's patients, she had multiple failures, never
yeah,
conceived,
yeah.
and after the immunological treatment,
Hmm.
she had 4 embryos left. So the IVF specialist said ki she has never implanted. Let's put all four,
Hmm.
and you won't believe, all four got implanted,
Oh
and
my God.
finally they had to do a
Reduction.
reduction.
Very nice.
And such things have happened for other patients also. All 3 embryos implanted, all 3 pregnancies continued where never they were implanted before. So
In fact, there was one more patient which I think that was like we had made embryos and then I had sent her for LIT. And then after she said, "Ki, madam, now my financials are not in place. I want to do the embryo transfer after 2 months. I want to go to my village and everything." And she went to her village and she conceived naturally over there. She conceived naturally over there, and she conceived and she delivered also a healthy, nice baby girl. And then she called me and she said, "Okay, I'm done. I just wanted one child. So my embryos are there. I'll be happy to donate it to another couple who is wanting for a baby."
Oh,
So
that's
even such things have happened. So I think this is one frontier, a very new frontier which must be explored. I think it's really opened a lot of avenues for people who don't want to go for surrogacy. See, it's not surrogacy is not everybody's piece of cake. It's not everybody's thing. Even if you go to a very very economical surrogate agency or anything, at least a minimum of 8 to 10 lakhs is what expenditure will come, no matter what you do. And of course, if you go to really big ones, it may even go up to 18-20 lakhs, where you have the option of choosing the kind of surrogate you want. There's a lot been told about this movie also, Mimi, if you've seen. I mean, it's a movie which got it released last week, on Netflix, which talks about surrogacy. So even in that, they have shown that people don't understand what surrogacy is. If they see a pregnant mother, they would not feel that she might have conceived from another embryo or
the
anything like that. So it's there, especially in India. In metropolitan cities you can understand, but in the smaller cities and the smaller places, or rather the little slightly lower or middle socioeconomic class of patients, they don't take it in a very nice way. So they don't take it in a very positive way. So that's when these things come into picture, where patients are saying, "Ki, nahi, whatever it is, we will spend, but we want our baby." Otherwise we go for adoption. And plus with the surrogacy rules which are coming up, it's someday they say that the surrogacy is banned, someday they say that commercial surrogacy is banned, something or the other keeps coming. So when we are dealing with in a country where the surrogacy rules yet are not very crystal clear, we have to think about the other options. Even uterine transplant is, I think, Dr. Sailesh sir is the only person who is doing it. And what is the success rate? I mean, even if maybe if you're doing 10 cases, 12 cases, maybe 50%, 60%, I wouldn't say it's also 100% foolproof thing where it's a very successful surgery. Also, for a patient who is dealing with infertility, it's not easy for her to arrange for a donor uterus. It
uterus,
can
right,
be,
right.
it's a very ideal picture where the mother would give the uterus and all that. Like, suppose I, God forbid, had a problem. Fortunately, I'm blessed with two daughters. But if I had a problem and I would want to take my mother's uterus, it's been removed 10 years back already. So what can she do? Even if she wants, she cannot help me out. So looking at the practicalities and looking at things, obviously, even in LIT, you must be having some failed cases as well. It's not a hundred
Yes,
percent thing,
definitely. It is
but
not 100%, but
of course, but in a place where you are dealing with, not what to do, there's nothing left to do. So immunology has been a very, very phenomenal frontier, which I think should be more explored much more in depth.
and I think it should be explored much earlier.
Yes, correct,
Other than just give patients spending time, money,
correct,
everything, physical, emotional, they go
yeah,
through so much of this.
correct.
So,
You
if
shouldn't wait for
after
two.
one or two failures itself, if someone can think about it, then
Precisely the
everything
reason
else
why.
has been done.
Yeah, correct. Correct, ma'am. So precisely there's one reason why I got one more patient 2 months, 2 weeks back who had just one IVF failure. But I don't want
Exactly.
her to undergo the same trauma over and again, over
Exactly.
and over.
Yes,
Again, I
yes.
have another patient who is again like she had a very confused picture. When she came to me, there was a doctor who said that there is hydrosalpinx, we need to clip the tubes and then only we can proceed with the IVF. Then when I did the sonography, I couldn't see any hydrosalpinx. I sent her to another radiologist for a 3D ultrasound. Even he commented that there is no hydrosalpinx. We did one IVF, it was negative. We did one other IVF, again it was negative. Now we started re-evaluating the case. So now there is again a hydrosalpinx, which was not there for these 2 months. So that there is a hydrosalpinx. So when she came to me, I thought, let me explore the other options. She doesn't have any thyroid or anything like that. But when I did the anti-TPO antibodies, even the anti-TPO antibodies are positive, and a couple of other things are positive. So this patient now is coming to me on Monday, which I'm going to send her to you.
Yeah, because, and everything could be there together. Like all
Yeah,
the factors could coexist,
correct.
which is something which we need to explore. Like, as a part of the infertility evaluation,
if we
Yeah.
can include this, we can
Yes.
come to know at a much earlier stage that this
Definitely,
is
ma'am.
one of the
Definitely.
reasons.
After so much of discussion over so many years, finally people have started incorporating the APLA profile into the APLA
Exactly.
profile and genetic profile into their workup, which
Workup,
involves
yeah.
previous one failure or previous miscarriage. But the immunological part till now nobody sends it. Nobody sends it. I mean, even the biggest of the biggest gynecologists, I have worked with such big people, even they wouldn't send that immunological profile, which now I feel the minute a patient comes with you with maybe even one or two
Okay.
miscarriages, or who has come with one IVF or maybe two IVF failures, where it is very crystal clear that the IVF part was good, the soil and seed was good, the patient is young, but still she is not conceiving. So in those kind of patients, most certainly the immunological panel must be incorporated. I strongly believe that, and I don't care about whether things are going to change all over India or not. At least in my practice, I have incorporated it. In fact, you will not believe that I have also got a print. Like I'll show you. I have got investigations printed onto my sheet. So I have these investigation chart which I usually have. So you will not believe I have actually given for printing one more chart, which is for previous miscarriages and IVF failures. So that protocol which you send it to me,
Excellent.
the protocol the list which you send it to me, I have got that
Definitely.
printed on a paper, and it is my protocol now that if I have got even one IVF failure patient to me, I'm going to tell the patient that you get investigated. If an IVF patient is capable to do IVF for maybe 1 lakh or 1.5 lakh, I'm sure that patient is capable to do a test worth 15-20,000. So that is the place where you don't think कि ये महंगा test है कि सस्ता test है, doesn't matter. We have to understand why. That why has to be answered. It cannot remain a why forever. Because if you are not going to do anything differently, you're going to lose that patient. You are going to do the same IVF,
Absolutely.
you will make good embryos, you'll put in the embryos, again you'll end up in a pregnancy. That patient is going to go to another doctor. Only if the kind now this patient I'm talking about who's coming to on Monday, she's had two IVF failures, but even now she doesn't want to go to another doctor. So that is my luck that she's got that trust in me. But if it is another patient, maybe that patient would say, now I need to go to another doctor. Again, that doctor will start right from that hydrosalping and start from step one, and again do another cycle and keep beating around the bush all the time. And even in your practice, you would have seen, ma'am, that this same story goes on for years.
Yes, yes.
One failure.
Absolutely.
Yeah, so patient will come with you and she'll just place one big bunch of 10 files in front of you. Big, 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 big doctors from different places doing the same thing.
Absolutely.
You should somehow have that faith in your previous file guy. The patient who comes to you, in fact, for me, I learn from those files. I don't sit with that file to see what was not done. There are a lot of doctors, again I'm sorry to say, but a lot of doctors will say कि नहीं, ये embryo transfer ठीक से नहीं किया, अरे ये बहुत junior doctor है, तुम इसके पास क्यों गए, या अरे embryos were not good, why they transferred only one embryo, why they transferred only two embryos, your lining was not looking good, why they did embryo transfer. That is something which I just don't do. I stay very clear from that. I know for a fact that if a doctor has opened an IVF center and has been in practice for so many years, that person can't be a fool. So for me, that's how I analyze the patient. That's how you will not believe, my first IVF consulting takes around 35 minutes. A new infertility patient ka case sheet aayega, so my nurse and my assistant know ki now madam is going to take 30 minutes. Why do I take that 30 minutes? Is I see each and every step where what could have gone wrong. Now, if doctor has placed 3 embryos and the patient has not conceived, there could be some problem. I wouldn't go back thinking कि अरे उसका lab अच्छा नहीं है या उसने transfer अच्छे से नहीं किया होगा. That is a very negative approach towards things, and that doesn't take you anywhere. So now I have got this printed thing. I will in fact share it with you also. It is gone for printing. That I'll get it by
Okay.
Tuesday. So this is
Sure.
I've written investigations for previous IVF failures / previous miscarriages. So I tell the patient that if you want to start treatment with this test I want. Before this test, I'm not putting my hand into your case. They are very well following it. They are very open towards it.
Absolutely. See, as an IVF doctor, I think you are in the best position to rule out all these problems,
Correct.
genetic,
Yes.
because otherwise a regular gynecologist or infertility specialist may not be able to actually test
Correct.
for genetic problem, test for
Right.
the other things. So you are in the best position to rule out. So
Hmm.
might as well give benefit to the patient and
Definitely.
save patients energy, money, whatever efforts.
Definitely,
So
ma'am. And these patients who've had previous failures, they reach a stage where they say, "Ki money is not a problem. We will spend the money, but we want the result." because repeatedly getting this negative result brings the confidence down to such a different level. And especially women, somehow life is a bit easier for men in India, at least the psychological part. Even if they have to work very hard or whatever, the psychological part, it's easy for men. Whatever said and done, at the end of the day, it is the lady who is going to sit at home and who's going to keep listening to people who will keep poking her that why are you not mothering a child, there'll be very few people who will ask the man कि अभी तक तेरे को बच्चा क्यों नहीं हुआ. But I've had such emotional stories, who even come and tell me, some families, ma'am, if this year she doesn't conceive, we are doing another marriage. you know Even those kind of patients have come to me, and it's so painful. That is where, for me, when I'm dealing with an infertility patient, it's like a personal war. For me, I consider that as women empowerment. For me, giving that power for that lady to tell her mother or mother-in-law that, see, I have conquered it, I have become a mother. So now just keep quiet and let me just live my personal life in a happy thing. For me, it's like a war, like a personal war. Like this is a this shouldn't be treated like a case. You have to win this war of infertility.
Absolutely. I think, Dr. Amiti, with this perfect approach to this problem of infertility, I
Yeah.
think your even second center is not going to be enough for you. And I think there will be more than
Chain of centers.
chain of centers soon are likely to be there at the horizon.
Thank you
So
for
I think that's really nice, and nice to know about your approach or your thinking. Not only medically but as a person,
Hmm.
how you feel about the patient.
Yeah.
So, finally, I would just ask you, ki, what will be the take-home message
Hmm.
which you would like to give our viewers? Because our viewers will be both doctors and patients. So, what would be a take-home message you would like to give them?
Yeah, so ma'am, the take home message, most important, again, I'm emphasizing, is that when you realize as a couple that you're dealing with infertility, please don't keep waiting. That is one thing, one mistake which you can't be doing, whether it is the any class of patient, whether it is lower, middle, upper, whatever. If you are seeing that, you having a perfect sexual life and you have been trying dedicatedly for almost 1 year, 2 years, don't keep wasting time, because age, as I said again, is a very important factor, especially for women. What happens is, why age is very important, there are two very important factors. What happens is that with age, as we all know, that going a little bit to the genetic level, the spindle which is there, this spindle is basically is going to decide how the chromosomes are going to align, and how normal the embryo is going to be formed. This spindle part which is there, that makes a very important factor. So when the woman starts aging, the spindle, there is breakages in the spindle. It is that's what the evidence and the genetic studies have showed, that for aged women, there is spindle breakage, and that will lead to a lot of genetic abnormalities in the embryo. And even if the embryo looks grading wise, it looks normal, most of the time it will be a genetically abnormal embryo. So that is one thing, which is why now there is a new frontier where they do the spindle check. There is a very beautiful instrument which is, it's a Japanese instrument which I think a lot of very senior people have, in which the magnification is so high that they actually see the spindle, where the spindle is there, and they make sure that while doing the ICSI, they don't cause any damage to the spindle. So they do spindle check before doing the ICSI. They make sure that the spindle is very much away when they, pierce the ICSI needle into the egg, so they
Okay.
don't disturb the spindle. So this is a very advanced thing. That is one thing. Second thing, as the woman ages, there is a lot of oxidative stress which is happening. There is a lot of oxidative stress which again is going to cause genetic problems, and it is going to cause a abnormal embryo. So age is most important. Unless and until you have a young egg, that is going to really improve the fertility. And not just in, even in sperm, it's, people they have a very shallow approach towards, or very superficial, not shallow rather, they have a very superficial approach towards doing a sperm analysis. They will just see the count, just the motility, thoda sa morphology, and that's it, and they'll come to a decision. You have to really go in depth even while you're studying the sperm. If you have a patient who's coming with oligoasthenospermia, you need to do a DNA fragmentation. You need to see what is the DFI index. You need to see the DNA fragmentation index, and you need to rectify those things and then put the patient for IVF. Even those really bad sperms, those DNA fragmented sperms, even if they give you good looking embryos, they're not going to end up in a successful pregnancy. So again, this is one frontier where we are focusing a lot in our center. We do the minute we have a patient who's coming with severe oligohydramnios or severe oligoasthenoteratozoospermia, we do a DNA fragmentation. We try to understand. We do a very detailed morphological examination wherein we see which are the morphologically good looking sperm, because not everybody has a IMSI microscope. The IMSI, as you know, which is
Yeah.
a magnification beyond ICSI, where we can see the morphologically normal sperms, and we do that. We do a DFI. We do we have a protocol that before we do the IVF cycle, we give the husband at least 2 or 3 months of good antioxidants, which not just any random medicines, but antioxidants which are going to help this patient. After we give the medicines, we see the difference what is there in the sperm parameters, and then only we go ahead with the IVF. So I think that is very important. You don't directly have to jump into IVF. You have to prepare the couple. They have to be well prepared before they get into IVF, so that we can get the best kind of embryos. When we have a best soil, when we have a best seed, the plant is going to grow. Unless there are some underlying factors which we just discussed, that we've got some immunological factors, or we've got some genetic problems or anything like that. So most of the time, if a young couple comes to you with infertility, it is solvable. But so my take home message would be that to couples, first, even if you cannot directly find a infertility consultant, go to your routine gynecologist. Tell them that I'm having this problem. Let them explore what the case is. Go for an early treatment. Don't wait. That is one thing. Of course, infertility is not like cancer, but treat it like cancer. Go to a doctor as soon as possible. The minute you see that something somewhere is going wrong, go to a doctor, consult the doctor, and try to understand and try to be receptive as to the other frontiers which are available. As I said, genetic testing. Even for a gynecologist, it becomes difficult for a patient to make them understand what is immunology. It makes it
Right.
difficult for them to understand what is genetics. If an educated couple comes to it, life is simple. But in counseling, the counseling part. But if a not a very educated person comes to you, you talk about genetics and all, they will run away. They're like, "Pata nahi kya baat kar rahe hain." So you need to be a little receptive about all these things, and just follow whatever your doctor says. So that would be the take home message. And I think we should really not only our patients, even a lot of fellow gynacs, a lot of fellow infertility people don't know much about LIT. They don't know much about what has to be done. They don't know much. They don't even know कि क्या procedure करते हैं. Like you take the lymphocytes and you inject it into the wife's body and all of that. So I really feel that you both are doing such a phenomenal job. You need to put it across as you're doing through this LIT show. Have a lot of discussions and have a lot of in-depth details as to how the process is done. Whether it's a lot of people keep asking ki, how many sittings will it take, after how many sittings can we do the transfer, what is the role of intralipid, what is the role of bar globe, what is immunoglobulin, what is the role of so many other things which you give, like HCQS, we have got azathioprine, so many things. So I think you'll have to spread a little more awareness, having more webinars, more conferences, and maybe you can that's just a suggestion. Maybe like in maybe 3 or 4 months, you can actually connect with some IVF centers where that doctor can call her previous failed cycles, or maybe 3 or 4 patients together, where you can give them education about this whole concept of immunology.
Great. I think it was wonderful to have you here with us, and
Thank you.
you shared about your education, about your experience, about your patients, and valuable tips to the patient also.
Yeah.
So we had really good time.
Thank you. It was a pleasure. The pleasure is all mine. I'm very, very, very privileged, ma'am, that at such a young age you have called me as one of the guests. I've been seeing the previous guests. They are all very senior people, be it Dr. Kshitij or be it Naina madam. She's like a icon. She's not somebody, it's not a simple person. She's in all the first six guests have been very eminent, very senior people. So I'm very humbled and very honored that you thought that I am capable enough to reach this platform and converse with stalwarts like you. I really look up to both of you all, ma'am, because it takes they always say that one idea can change your life. So despite you all being gynecologists, you had the vision to explore this unknown frontier, and you all are doing such you have proven your might that no, this is not something which can be ignored. This is something which can help your patients, and you've reached that level where people have people from all over India are sending you patients. Dr. Naina also that day, madam said that she's been sending a patient to you who's coming to you for therapy, and a lot of brilliant people are looking up to you for help. I think that itself is a very big victory, and it's a real big award for you to be in that place where such big consultants look up to you for help. So it's really, really phenomenal, ma'am. The kind of work which you're doing is phenomenal, and I'm sure you have got so many blessings from so many infertile couples, and they must be really looking up to you as god figures and all. So I would really congratulate you, ma'am and sir, for doing some brilliant work. And just keep working working so well so that we can become heroes in front of our patients.
Thank you so
Thank
much.
you
Thank
so
you so
much.
much.
Yeah.
Yeah.
So I think here we will come to the end of this show,
Okay,
and
ma'am.
hoping to see you soon, maybe
Sure.
in person. But all the best for your
Thank you.
new ventures,
Thank
and
you.
take
Always
care.
looking up to your help and your support, Stan. And thank you very much for always being there with me as parent figures. Really, I look up to you a lot. Thank you.
Thank you.
Thank you.
Bye, ma'am.
Okay.
Good day, ma'am. Take care. Bye.
Okay.